Good evening, everybody. I'm Dr. Krishna Surendran, a gynecologist hailing from Nagercoil, Tamil Nadu. Today, I would like to talk to you about preterm birth. Preterm birth, every pregnancy, the maximum normal duration is around 40 weeks. Now, when a woman delivers before 37 weeks means she has completed, the baby is okay. It's okay for the baby to survive outside the uterus. Now, if any preterm birth below 36 weeks, we term it as preterm birth. Now, why do preterm births occur? We are the capital of the preterm births. In India, we have the maximum number of preterm births. Why? There are many reasons. Or it could be this thing. One is shortening of the cervix. It could be a shortening of the cervix. It could be an infection. It could be other factors like you could have a fibroid, a tumor inside the uterus. There could be dietary deficiencies, low pre-pregnancy weight, any extremes of age, teenage pregnancy, or even an older person, an older mother. Because now so many women are postponing having their child. So these kind of things can lead to preterm birth. Now, what is a symptom that they will get? Of course, you will know when the pain starts, or there is abdominal cramps, there is a change in the vaginal discharge, there is a watery discharge, or a bloody or a mucoid discharge. There is an increase, there is a low pressure in the abdomen. Sometimes you can have contractions. That is the most pathognomic feature of a preterm birth. Now, when you have that, what you must do is never delay coming to a doctor at the earliest. Because what we would like to do is, we would like to maximum how we can delay the baby. Sometimes a baby will need steroids. Now, in many cases, especially during infertility and all that, because it's an older thing, we do give steroids on a routine basis. Otherwise, there are drugs which can relax the uterus and postpone the birth, at least until the baby can be salvaged. So you need to know that you need to visit a doctor before, if you are in labor before 35 to 36 weeks of pregnancy. And even otherwise, once you get into labor, you must have a hospital delivery, because that can save so much of trouble later on. Home births is not allowed. Now, the other thing of preterm births is why we see preterm births is so difficult is the babies will need neonatal care. They will need. They will not just need. Sometimes they will. The thing might not closure. They will have breathing difficulties. So it is better that a preterm birth is avoided, and the baby is given antenatal before the delivery happens. Steroids can help in the baby having a little more lung maturity during the time of birth. So we are the capital in India. We are the capital of the preterm births. A lot of us have infections. Even a simple thing like having a lot of us have how do I put it? We have progesterone deficiency. So preterm births can be decreased by having this progesterones earlier in the thing. Now, a lot of patients, especially in a higher age group, we give it as routine, so that this part of it is not there. So this is what I wanted to share about you. It is a responsibility of the doctor as well as a patient immediately to prevent preterm births, so that the neonatal morbidity and mortality can be reduced. Thank you.